welcome to this second episode of the Endocrinology Committee podcast. And I welcome Dr. Sunita Tandulwadkar, who is the president of Fogsi, and Dr. Anjali Radkar, who is the professor and head at the Center for Study of Social Inclusion and Dean of Academic Affairs at Gokhale Institute of Politics and Economics in Pune. And we are going to discuss on a little different topic today, which is population dynamics. I would like to ask Dr. Sunita Madam to say a few words about today's podcast.
Thank you, Chaitanya. Thank you. Thank you, Chaitanya. First of all, congratulations for getting such a fantastic faculty. Madam, I was knowing Gokhale Institute, but I never knew who is the dean, and so great to meet the dean of this such a beautiful, prestigious institute of our city. And we happened, all three of us being in Pune city, we definitely will catch up physically. This Gyan Pravah is our podcast series. In Fogsi, there are 30 committee chairpersons, and each committee chairperson has been given one day of the month. And on the same date, every month, they come out with beautiful, fantastic idea, and they come out with the one great faculty on which they can discuss the different subjects, which are rarely discussed probably in our day-to-day practice, or they may come out with the gynecologist. The academician series is becoming very popular. At 8 p.m. every day, we join, and around 45 minutes every day. It's so beautiful. Even if you are doing something, just put up a Bluetooth and keep on listening, at least if you can't view. So I'm sure this podcast will go fantastically, the dialogue between you and Chaitanya, and I will be listening to you all from the different link. So thank you for coming on a Fogsi platform, and probably this is a very different topic which is going to discuss on population. So something out of the box, I think. Thank you.
Thank you.
Thank you.
I think let's move on with the topic for today. And
Chaitanya, would you like to let us know more about Dr. Anjali ji?
Okay. So as I said, she's a demographer and a statistician, and she's working presently at the Gokhale Institute of Politics and Economics. She has been working in the area of demographic research for the past several years, and her major research interests have been in Indian demography, the sex ratio, son preference, age and sex structure of the population, female workforce participation, maternal and child health, mortality, morbidity, and nutrition, and health system researches. She has been pioneer in grants which have been taken from UNFPA, UNICEF, and Government of Maharashtra, Swiss Aid, including the individual grants from MacArthur Foundation. She is currently working on the projects of undernutrition in the tribal areas of Maharashtra, tribal livelihood transition and nutrition transition apart from the socio-economic studies and population projections of different villages in the city of, including the city of Pune. She has designed and launched the MSc program in population studies and health economics at the institute. And she teaches multiple courses in population studies and research methodology for postgraduate and doctorate students in the institute. So we have a versatile person with us today, and who has been working in this field of population studies for quite a long time. So I felt that it's a little different topic, and which we as doctors are not exposed to very much, and therefore I thought it would be a good platform for me to have her today and discuss a few things about population and how it helps or how it impacts the different aspects of our livelihood.
Thank you. Thank you. Enjoy your discussion, and I'll be listening from other link. Thank you.
Thank you. Yeah.
Thank you, madam. Let me just start with a little basic things, and then we may take up with specific questions. So when we first met and when we were just discussing about what all things basically you are into and what are your interests, one thing which came up very prominently was the population studies. And that was the first time when I thought, ki, what is this actually a population study? And what do you exactly do when you say that you are into population studies? So if you can just elaborate on that for us, so that we can take the things ahead from there.
Okay, yeah. But at the outset, let me express my gratitude. Thanks that you have invited me on this platform, and you are interested in listening to what the population studies is, and you want to also understand the nitty-gritties of it. So I really thank you for that. And I also thank you for a very kind introduction. And yeah, I've been working in the field of population studies for several years. Population studies is actually, if you see, it's a interdisciplinary subject. Like initially, I mean, it is, as the name suggests, it is about the population, and it is also called as the demography. Demography is a study of people. So it is, yeah. Initially, it is about the counting heads. That is how many people are there, but that doesn't give us everything. So once we have the number, we feel like having so many other things about the population. So we want to know that is who are they, like say whether they are the men or women. Then we are also interested in looking at what their ages are. Then we are also interested in knowing what the education is, up to what level they are educated, what they are currently doing, what they were previously doing, whether they are at the same place for a long period of time or they were earlier somewhere, or they're staying in a rural area or urban area or whatever. So we like to have a lot of information. So just the number doesn't give us everything. So we really want to know so many things about the people, and that all comes under the population studies. It is a kind of a thing, like it is, we always say, I mean, it is related to the statistics. So population studies and statistics are very closely related because we are looking at the data, we are analyzing the data, we are trying and projecting the data. On the basis of the information, we compute some rates, we compute some ratios, this, that. So it is very, very closely, very closely associated with statistics and mathematics. Then it is also very closely associated with the economics, because want to know that is okay, what is the age structure of the population, means how the economy will grow or not grow, or whether there are any prospects of growth, and if there are prospects of growth, then what can be done. So all that thing, so it is related to the economics, it is related to the sociology, because we are looking at, say, I mean, just to give you the example, the education. So what is the level of education? So whether the people are literate, illiterate, men are literate, women are illiterate, whatever, and up to what level they have gone. Because education is one such variable which has an impact on every sphere of life. So how they are educated. So, or maybe when we are talking about a sex ratio, as you mentioned, some of my studies are related to that. Then what is happening sociologically? So if the females are lesser in the population, means what? What are the consequences? What will happen to the marriage? Whether there will be some kind of a marriage squeeze? We would like to know all that. So it is related to the sociology. So I mean, if you look at it, and of course with the medicine, your own subject, that is because it is related to the diseases, it's related to the transition, because population is never a static thing, okay? It is continuously changing. And why it changes, as all of us know. Now, so the medicine also comes in very strongly in the study of population. Of course, not the clinical one, but kind of a public health related approach, what the community is doing, what are the requirements of the community, etc. From that angle, I would say.
Wow. So, I mean, see, it's good to know that population study, for me, when it came to population, the only thing which I knew about is the census, wherein there is a count for the number of people which are there in the particular area or particular country, and which happens every 10 years or 12 years. Even I don't know even that what is the frequency at which the census takes place. But that's all what I knew about when it came to population studies. But it's good to know, or I'm surprised to know that population studies help us in so many different areas of our life or of a country. Does these studies really help us in changing or bettering the impact of or on the population? Or you, when we were discussing about population, you mentioned about something about population dynamics. And that's the exact topic for today's discussion, or the title of today's podcast. We have given it as population dynamics. So what does this mean? What is population dynamics? And whatever we are studying related to the population, does it have any impact on bettering the overall structure of the society?
Yes, definitely. As you said, that is census is one of the most important sources of data. So I think I should spend 2 minutes talking about the census, because that is something very close to my heart. So
Okay.
census is the most important source of population data. As you said, that is every 10 years we conduct the census. From 1872, I mean, the first census in India happened in 1872, and the last census was in 2011, and it was the 14th census. So from 1872, we had the next census in 1881, and then uninterruptedly every 10 years we had the census. So census taking, in the history of census taking in India, is commendable. I mean, in spite of so many problems like the British rule, then there were at the time of the 21 census, that was that time it was a pandemic and the plague and the World War. So still it happened. Similarly, during the independence, all those movement was going on. That time also, every 10 years the census happened. Even in 1951, immediately after the independence, the census happened. And we have all the data, figures adjusted for, taking out Pakistan and Bangladesh. So it's actually a gold mine of the data that we have about the population. Unfortunately, 2021 census couldn't happen because of the COVID, and now we are actually awaiting for the next census. So let's see when it happens. The government is still not talking about it, but let's see when it comes. So census is actually, it gives you the count.
A very humongous task
It's a
to
humongous task. And
in a populated country like ours.
But it's actually the machinery is well trained. I mean, in
Okay.
India, the Home Ministry does this work, and there is a census commissioner and the Registrar General of India. Under their guidance, the census takes place, and it's a very, very well structured kind of a system that it is. So we don't have that much time to talk about the census. Otherwise, I can go on census for a long time. But census is, as everybody knows, and so we have the data, and it is the data that we get is aggregated data. So we get the data for rural, urban, ward-wise, every village-wise, and we get the data on so many things. I mean, that is once again, and it also gives about the assets. I mean, it is whatever the village. Suppose if we are looking at a village, then the information like what is the nearest bus station and how far it is, the distance from the nearest city, whether there is any kind of a health facility available, private, public, then the transport, whether there is a road transport, whether there is a electricity, all kind of amenities. So it's a huge data that we have. So
It's
unless
not just about the number of people and men and women. So
apart from that.
More than that. Okay.
Yeah. So we have the data on the men, women, education, their occupation, migration, their fertility, assets, amenities, what kind of houses they stay in, then the drinking water facility, toilet facility, bathroom facility. So we have huge data. Then we also have the data about the disability, We also have the data about the fertility. So all those tables the census produces. So this is one source of major data, but there are other sources also. Actually, there is something called as the sample registration system. They have a dual registration system, we call it, and they give us all the rates that we are really interested in. That is the birth rate, death rate, infant mortality rate, maternal mortality ratio. So all these things, that is the SRS gives us. And there are some kind of a large sample surveys that happen in India that give the other data. So there are many sources of the data, and on the basis of that, we can project also. So yeah, and you were talking about the population dynamics. So the population change, the population is continuously changing, right? So, and the change happens because of the three parameters, as one can very easily guess. It is fertility, mortality, and migration. So the population changes because of the births, because of the deaths, and the migratory movement. Somebody comes in, somebody goes out, somebody dies, somebody new births are there. So these are the three things basically that give you the change. And when I have the population figures, when I have a growth rate, or when I have, or the vice versa, when I have the fertility, mortality, and the migration rates, I can guess about the population. I can guess about the age structure of the population. So, like, for example, when I say the fertility is high, for all these years, Indian fertility was high, all of us know, and we've been trying to get it down. So, the fertility was very high. So, in the Indian population, the share of the children in the population was very high.
Right.
At that time, the life expectancy was less. So, share of the elderly in the population was less. And the children were more. But now the fertility is going down. And when the fertility is going down, the share of the children in the population also is getting lesser and lesser. And life expectancy is also increasing. So share of the elderly in the population is increasing. So these are the changes. And because of the course of the fertility and mortality, these changes are reflected in the population. So it is changing. This is one thing. And it is also, we also call it as a demographic transition. So nothing is similar. Like you know about the nutrition transition, you know about the epidemiological transition. So exactly like that, it's a demographic transition. So it depends on the course of the fertility rates and the course of the mortality rates. So if the difference between the fertility rate and the mortality rate is more, the population, there will be the large gap and the population is going to be more. When that gap comes down or it narrows down, the growth rate comes down. Now, I mean, very recently, I read an article about the Japan. So Japan is something completely different kind of age structure. But there, in India, the fertility and mortality rates are say like 15 and 6. But in Japan, for every birth, there are 2 deaths. The rates are such.
Okay.
So it is because the age structure is different. It is the old age structure, and this is how it is reflected. So these are the dynamics that I'm talking about.
Okay. So is there any major change that you see in the Indian population when we are saying about the age and the sex structure? What was there in the past and what is there today? And how that is going to impact our future? Because what I see or gather from your what you just said, that fertility is going down. That means less children are born, and therefore, when going in future, probably we would have less people who are in the younger age group, and maybe more
Absolutely.
people who are in the older age group. So, will that have any effect or impact?
Yes, definitely it will have an impact. Currently, I mean, if you look at it today's situation, we have about 60% people who are in the working ages, that is 15 to 60 years. And there are about 30% in below 15. So that is, we call it as children working ages and elderly, that is 60 plus. So it is about 60, 30 and 10. But this is going to change because as the fertility is going down, the share of the children is going to come down, as I said just now. So the share of the children is going to come down and the share of the elderly is going to increase. And then it has a definite impact on the economy. So when the share of the elderly in the population increase, we really need to think about, because that is the population which is economically not productive. And that is the population which is going, we need to provide them something in terms of financial help, in terms of physical care, in terms of medical care, in terms of residences, in terms of several things. I can just go on listing. So these are the people to whom we really need to provide, and we don't have any kind of a social security. So do you think that is the state will be able to provide for the 10%, 12% elderly currently? And now the fertility is going down, so the children are less. For some time, we are going to have the large working age population, but eventually that also will start shrinking. So those who are in the working ages also, if they start going down, then who will work? Because these children are getting lesser and lesser. So lesser and lesser people are coming in the working ages, and all that they are going to travel to the higher age groups. So maybe to the elderly. So the estimates for 2050 are like more than 20% population is going to be elderly. That means 1 in 5 will be elderly, which is a huge number. And the country like us, where there is no social security, and so it is very difficult to support such a large elderly group.
So that's going to have a major impact on the social structure as well, because
Yes.
maybe as the number of people who are growing old increase, we need to have that kind of a facility, healthcare systems that will support these elderly people.
Absolutely.
Maybe we don't have that kind of a structure at present. So
Yeah.
all these things would help us to think about our future, what all things we need to plan in an attempt to make sure that these aging populations are taken care of, right? So I'm a gynecologist, and many of my friends who are from the healthcare sector are watching us live. So I would like to know how population of any country shapes the healthcare of that country. Is there any connection or association between these two? And does it help us to formulate any guidelines for the kind of healthcare system what we should have, need, or should be in the future?
Yes, yeah. On the basis of whatever the data that we have, we can have the idea. I mean to say that is now we know that there are going to be the lesser children and they are going to be the more elderly. And of course, the working age population is there. Life expectancy is increasing. So, what has happened? I mean, if you look at the health system, we are also going through the epidemiological transition, because at the same time we are developing. We are developing economically, we are developing socially, and overall now education is increasing. We are at par with so many things with the Western world. So there is a lot of development, and we are also going through the epidemiological transition. So now, as if you look at the children, then the survival of the children is kind of very close to 100%, I would say. Because the country like India having only 25 IMR, it's quite an achievement. So all the diseases which are vaccine preventable, we have already controlled.
Correct.
So now what is happening? So most of the communicable diseases we have controlled, and now what we are actually facing is the non-communicable, and so all the lifestyle disorders or whatever, the genetic ones. I mean, you know it much better than me. That is me explaining you. That is all kinds of the diabetes and the cardiovascular and cancers and accidents, of course. With the development, what comes in is the accidents. So the cause of death data, if you look at it, like the Maharashtra data, actually long time back, actually I've seen, and the curve has changed now. So initially it used to be the U curve. If you age specific mortality, if you plot, then initially it used to be the U curve. So
Okay.
this left side also used to be high. Now it has actually become J.
Okay.
So it is a J type of curve. That is the infant mortality is controlled, and this is going to go up. So now what is happening is now our fight is not, it's not there with the communicable diseases. So what we need to fight with is the communicable diseases.
Non-communicable.
And now when you are looking at a health system, the health systems we should have, which will give us the all kind of the cure for this non-communicable, or how to deal with it, because some of the diseases, as we know, that once they are there, you just have to control them, or learn to live with them. So these are the things. So that kind of the health system that is we will require. So primary health care was our need of the yesterday, but today what we need is the more and more care for this non-communicable, meaning the tertiary care. So I'm sorry. So we are moving. So we are moving from primary to tertiary. So our health system also should be equipped to deal with this. And basically, so these are the things that we are going to face. And and we should also look at the costs, because the tertiary care is equated to the cost, high cost, healthcare cost. So that also we need to look at. I mean, our budget should be in such a way that something extra should be added for treating these non-communicable diseases of the elderly population, or maybe the older population. So those who are in the 40s also are catching up with all these diseases. So for them also we require this. So this is the requirement that we have. And primary healthcare, of course, that will continue for some more time, because though I'm saying that is 25 IMR is achieved, it's a great achievement, but still we really need to go like, say, the Scandinavian countries have it like 3. But we have the states, we have Kerala, which has less than 10, we have Maharashtra, we have Tamil Nadu, but not everywhere. But so for some time we need to concentrate there also. And so we are facing a double burden. That also we sometimes say.
Okay. So it's a good insight that you have given us, that we should be changing slowly from primary health care to tertiary health care. Now, what I see now today is that most of the tertiary health care is accumulated or is concentrated in urban areas or in the cities, and equal tertiary care is not available in the rural areas. So maybe going ahead, we might have to look at it from that perspective, that more and more tertiary care centers should come up in the rural areas as well, as compared to what urban areas have. Maybe that can also prevent the migration from rural to the urban areas, because that is one of the important reasons why people prefer to stay in the cities, because the facilities which are available in the cities are more and much better than what they have back home in their rural areas. But is there any difference between the rural and the urban healthcare delivery system? You said that rural is much more structured than urban.
Yeah.
I'm amazed when you say that, can you just throw some light on that?
Yeah, see, I was talking about the public health system. That is in 1946. the Bohr committee report came, and this Bohr, Dr. Bohr has actually designed the healthcare system for India. And unfortunately, it is implemented only in the rural areas, but also fortunately, it is implemented in the rural areas, I would say. So it is very, very structured thing. So every 5,000 population, we have one sub-center. For every 30,000 population, we have one primary health center. Then we have the community health center. We have the district hospital. This that. So, and at a village level, there is an A&M, or there is MPW, or nowadays we have all these ICDS. I mean, though it doesn't come under health, it is the women and child, but still, ICDS center per 1,000 population we have. In every village we have ASHA. So now what happens is, somebody in the rural area is not well, gets the treatment, at least the primary one, at the doorstep. So if the person is not well, he or she doesn't have to really walk to the healthcare system and get the medicines. So somebody will come sometime and give the medicine. So that kind of the system it is. So the A&M is supposed to make the home visits. The ICDS worker is supposed to make the home visits. ASHA is supposed to make the home visits. And because of that, there is nobody for whom it is the healthcare is not accessible. Of course, I mean, there are pockets and there are people. I mean, you can give me 10 examples that is okay. It is not happening here and the people here are not getting any services. But it is because of the nature of maybe the geographical nature, or the accessibility issues, or maybe the sheer personal thing. But the system is designed in such a way that everybody gets the treatment. And then there is also the referral then. Suppose if it is something that the A&M can't do, then maybe the person will go to the primary health center, where the doctor will check up, and the further things like that. So in that way, the rural health system is a very perfect in a sense, and they also create a very good quality data. Once again, just because of our little bit of inefficiency, that the data is not aggregated efficiently. Otherwise, the data that is collected at the grassroots level, it's once again, as I said, it's a gold mine. I mean, they have the data, so you don't have to wait for the census to come. Every year they have the survey of the village, and they have the information about the people in the village. So now, but the most important thing is the urban. Like in Maharashtra now, when we have the 50% population is staying in the urban area, we don't have any information about the urban health, or we don't know about how many people are suffering because of, say, any communicable diseases. All the estimates that we have, I'm so sorry, in the urban areas are, I think they're not reliable.
So on the contrary, we always keep on saying that urban people have more access to the systems and all, but that doesn't hold true when it comes to actual data which you have collected. As you rightly said, yes, many of the women who are staying in the urban areas, they don't have access to the healthcare system, or there is no one who goes to their doorstep and asks about their health. How they are doing, whether they are taking the medications or not. When it comes to, say, antenatal women, for us, whether they have taken the hematinics, whether they have taken the calcium, whether they have taken the tetanus toxoid injections, which on the contrary, in the rural areas, the bonding between that ASHA worker and the women are quite strong, and therefore she knows about each and every woman who is say antenatal or pregnant in that particular area. Interesting to know that, again, all this data would help us to design the or plan the future, in what kind of delivery systems the healthcare should have. Right. The entire world is now saying that India has a very large young population, and that's the reason why the entire world is looking at us, and they are looking at us from different perspective. Some of them are looking for their own gains, like it's a very good market wherein you have this. Is it really true? Does your studies say that? And how is that impacting us as such?
Yeah, India is a young population, obviously. I mean, if you look at the Western world, or if you even look at China, we are young. So, on an average, the median age of the Indian population is 29. So, in that sense, because that is, I mean, it is a positional average, and we are so the share of the children is very high, and so that is why it is, and the elderly are still a little less. So that is why we have this figure. So when we have a young population, we have a large share in the working ages also. So that is why we are actually getting some kind of a advantage of the high proportion in the working ages. So so it is called as the demographic dividend. When the fertility drops suddenly, this kind of phenomenon occurs. It generally occurs in the life of every country. So, but what happens is that most of the time the countries are small or countries are kind of homogeneous, so they have that period very limited. But in India, we have many Indians. In one India, we have many Indians. So, and there is also the divide, north-south divide, we would say. The south is comparatively developed and the demographically advanced. So basically, this period of they call it as the window of they call it as the window of opportunity. So this window of opportunity is much wider for us. So it's for a long period because the northern states are demographically much behind. So that is why this period is much more. And so we should actually make benefit of this. Sorry. Yeah, you were saying something.
By the time the window for the south and west are closed, will be opening up for north and east maybe. And that's
absolutely
wider window which we have of opportunity.
Absolutely. And so that is the reason. So basically, so when this phenomenon occurs, then they call it's a boost to the economy. But when it will be a boost to the economy, that is all those who are in the working ages are working. They are earning, they are saving, they are paying taxes. Then only the economy of the country will boom or will grow. But so that is the first thing that we need to do. That is, we need to create the job and we need to give the work for everybody. So if we want to reap the advantages of this situation, then the more and more people should be working. So unemployment should be reduced completely. And the other thing is that we should give the quality education. We should give the skills to these people so that they will start working, because we can't create so many jobs. That is true. So if we give the skills, then they can start something that is, they don't have to go to the college, but they can be carpenters and plumbers and things like that, which are required heavily. So that kind of the thing also is required. So skills and education is one thing that we must focus now. And this is the time we have to do it now. And because otherwise the clock is ticking. It is, so we are going every day, we are getting older and older and older. So we have to do it right away.
It is closing every day.
Every day. So we need to do something very, very urgently. And then only we'll get the benefits of this situation. And if we don't, unfortunately, if we don't use this opportunity, then what will happen? So this year, 65% of the working age population is going towards the elderly. So the large chunk will be elderly soon. And where the fertility has come down, so there are lesser number of children. So later on, what is going to happen in the working ages, the share of the working ages also will go down. So the people who are going to take the responsibility, their share is going to go down, and those who require the help, their share is going to go up. So it is not going to be the dividend, it is not going to be any kind of a benefit. So it can turn out to be the other way around.
So there has to be a balance between these two populations actually. So whenever we are looking at this different rates, so fertility rate or mortality rate, there has to be a balance between the two. It should not happen that one of the population is too high and the other one is too less.
You can't, it happens that way only. I mean, if you see the Western world, they have already gone that way. Because so share of the elderly is much more there, and the share of the children is much less there. It's a demographic transition. It happens. You can't stop it. You really can't stop it. It goes that way only. So that is why you are seeing that some of the countries are encouraging migration. So you must have been knowing the people moving to Canada, people moving to Australia. So why it is for? So because they want the people in the working ages, because they are getting older, their own population, the children are lesser, so they want more and more people in the working ages. And that's why they are actually encouraging the migration. So maybe, but what will happen to India? You imagine, Indian people are going and helping other countries, but when the India will require the help, who will come? Who's there?
So who is there? I mean, what is your outlook? Are there any countries who are even younger than
Yes.
India?
Entire Africa. Africa is the country. Now, see, we always say that is Western world, Europe and all developed countries. They were yesterday. Asia is today and Africa is tomorrow. So by the end of the century, 40% of the population will be African. Of course, Asia, though giants are there, so we are 43% will be Asia.
Okay.
And remaining world is hardly 17%. So Africa is increasing phenomenally. So now currently they are close to 20%, which they are going to go up to 40%. So imagine that is how fast the Africa is growing.
So maybe that's an opportunity for them in tomorrow's world. But as you said, even today, when we have that young population which is there in our country, if we can make them work or if we can give them employment, they are going to help the economy.
Yes, absolutely.
Take this opportunity wherein we have a good economy to develop a system in such a way that when these working populations will go into the older age group, they will have the support and the healthcare systems which are needed at that point of time.
Yes.
Okay, so coming back to the question, what is this demographic dividend and how does that exactly help?
Yeah, that is what I was trying to explain. That is when the share of the working age population is more, and so that is the period which is called as the demographic dividend period, and because it gives you the benefits. Economically, it gives you a lot of benefits. So that is why it is called as the dividend.
So the window of opportunity, what we were discussing,
is actually window of opportunity
is similar to demographic dividend. And for us, it's a little longer because of the divide in the north and of our own country or within our own country. Okay.
Yeah, differentials in the fertility and mortality rates.
Okay.
Because of the differentials in the fertility and mortality rate across country.
Okay. So a question which comes to my mind is, does these all population study help us in our policy planning? And does it, do you give to the government and or do you advise the government based on the data which you have collected regarding how the policies, what policies should be there and its implementation? Do you do that?
Yes, absolutely. Absolutely. So all the population data is used widely for any policy development. I mean, like Gokhale Institute, we are the pioneers, like our ancestors, like they have the employment guarantee scheme. That is, have you heard about the Narega or Mahatma Gandhi Narega nowadays, which is called as, it is actually started here. It is the Gokhale Institute idea. Looking at the population and looking at the distribution of the population who are in agriculture and who are not in agriculture, and those who are not in agriculture, how we can give them the work and make them work, kind of a thing. So all that data was analyzed here. And then the employment guarantee scheme, the entire idea of the entire employment guarantee scheme came from here, from Gokhale Institute. Similarly, we have been doing it continuously for all these years. So when I started as a young statistician, as a research assistant in Gokhale Institute, the fertility was very high. That was the period where the growth rate was 2.25 a year. So it was huge, means like, and so we were actually looking at so how the fertility can come down. So all the government programs, what kind of the programs government should have. So we conducted so many studies. So how the means who will be the people who will accept the sterilization, who will accept any kind of a spacing methods and things like that. So I have actually analyzed a lot of data, a lot of population data, and come out with some kind of recommendations to the government, and they have implemented it. Then we have also given them the suggestions, and on the basis of that, they have made some changes in the growth monitoring system of the ICDS. So this is what our work, I mean. Then for Maratha Arakshana, that has been going on, the reservation of Maratha community, Gokhale Institute actually churned out a lot of census data and came out with whatever. They also conducted some survey also along with that. But the data that the census gives, the data that is available at various sources collected for different purposes, you churn out the data and come out with something and which can be directly used in the policy. And so we've been using it, government is using it. We are projecting the populations. Like very recently, we conducted one study for Pune Municipal Corporation, when 11 villages were, they came in the population, the corporation limits. And for that, they wanted to make a development plan. And for that, they wanted the population projections to be done so that they can plan for the thing. So we did that work. I mean, actually, theoretically, we shouldn't be doing the population projections for such a small pockets, but the corporation needed it, and they have some data, and we, with some kind of applying our mind, we have come out with that.
That helped them to devise their policy.
Help them to do,
how to plan for the future for those villages who were
those villages,
the corporation limits.
Yeah.
So I never imagined that there is so much to this population study, and major policies like Narega and all are based on the studies which you people do. Well, I would like to ask you the last question, that is, what is the future for India, looking at the population, projecting the population for future, and population and economy, population and healthcare, and what should be our focus?
Yeah, I mean, the population of India is, though I am continuously saying the fertility has gone down, I also say that the growth rate of the population has come down. I mean, I can't show you the graphs, but it really comes down like this. The growth rate has come down, but still the population in the absolute number is going to increase till close to 2050, 50 to 55. It is going to increase, because still, though the fertility has come down, we have a large share of the population which is in the childbearing ages. And if they have at least one child also, now the population is going to increase. the total fertility rate of India, that is the TFR, is the number of, on an average, how many children every woman has come down below 2 for India. But still, the population is going to increase up to 2050. So it will go, and then it will start coming down slowly, and it should be stabilizing at the end of the century. So this is going to be the population scenario, roughly looking at the current data. So based on the assumptions of how the fertility will fall later, and once again, it is based on the experience of the Western world. So this is going to be the scenario. So population is going to go up to 1.7, 1.8, and then it will stabilize. 1.7, not, it won't go up to 1.8, 1.7 or so, and then it will stabilize. So then about the healthcare, as you are saying, that is, there is a lot of scope for, as I said, the tertiary care, and so because the life expectancy is increasing, and it is going to increase in the coming days. And then we also call it something like the lifespan and the health span. In a sense, that is, the people are, they're not dying, but they're not healthy. So that is also something that we need to consider, because when you are looking at a healthcare delivery, you will be actually treating these people. So they won't die, but they will continuously need some kind of a support, some kind of a treatment, some kind of a medical care. So that is going to be there. So the medical faculty has a lot of work in the coming years, and they will be continuously required. And whatever the number that is available is not going to be sufficient in the future, and we are going to require the lot of medical and the paramedical personnel, because unless we have many of them, we won't be able to sustain to take care of this population. So for the medical, we really need to increase the number, and we need to increase the people with this kind of a specialization. So that is going to be, so for the gynecologists, it's bad news for you people. But yeah, we will require the people having these kind of skills more and more.
Elderly population is going to be more in future, and therefore we need to have the facilities to take care of these aging people. The healthcare future looks like, and we should be prepared, or we should start preparing ourselves for the eventuality which is going to be there in near future, or maybe in a few decades. I think we are close to 50 minutes now discussing about the population and the different aspects of it, and how we can help that, or how we can use that data of population dynamics to shape our future. So thank you so much, Dr. Anjali, for being here today on this show, and discussing with us about the different aspects of population dynamics, and sharing your thoughts about the same. I am sure that it's going to have a different insight into this for all of us, and it was a little different topic for all of us. We have not come across, or we have not read much into this. So thank you so much for throwing light on this. Thank you.
Yeah. Thank you, doctor, and thank you for your interest. I mean, what I really liked is that you feel that this is something very important, and we really need to look at it, because, I mean, you look at anything, you look at development, you look at growth, you look at medical care. I mean, it is all about the human, because human being is something which is the most important resource that we have.
Yeah.
So, and with the other resources, the human beings are doing good or bad, whatever. But basically, human being is a resource. And so we need to know many more things about this resource. And this is what we are trying to do here. Yeah, thank you.
Great.
Thanks a lot.
Great.
I enjoyed it being here. And I hope that is the people may find it interesting.
Absolutely. We will. We will. Thank you so much, Dr. Anjali. Once again.
Thank
Thank
you.
Yes.